that disease because there is a stigma when you talk about mental deficiencies or mental illnesses because we're gonna talk their names. We don't name type of disease. This is why if you see me is referring to psychiatric conditions is because you don't say someone they have a mental deficiency. I mean, we don't want them to identify themselves as like as a disease. Like if someone is a bipolar, you don't say you know try. You do the best you can. You don't. You help them the best you can, so they don't have to identify themselves as bipolar. The- So they can actually sometimes they can tell us, I have the conditions, but I do not identify myself as such. So to talk about myself a little bit, this is something I don't really do. So I do have an IG in psychology. When you say we have an IG, it's like we have a general knowledge on a lot of different things. Because I spent many years in school as a fun, but I didn't think about money and when I was going to school because I was always give myself try chance to learn different things so I can have choices so I can do different things and that's the reason why now I teach in high school math. It doesn't make any sense. At the same time, I do teach. It depends on part time in college. Like back in Texas, I used to do that. When I came here, I did it online to the same college I used to teach when I was in Texas. And this is me. And this morning I was thinking about it. I said, okay, you know what? Let me put some pictures so people can actually see the way I look. Okay. Yeah, this is me, and this is the first one with the glasses. The middle one is this is me also. And one thing we're gonna talk about too, when you learn about people, you're gonna learn about a lot of different things about people. If they're smiling a lot, their personality. That's something you're gonna have to know about yourself, so you can be able to help someone else. Next one. And this is one. This is something you don't have to read everything. So all I'm gonna say two things about myself. So if you first meet me, what you see is what you're always gonna see because I'm not pretentious. So I like to talk to people. I like to laugh, and this is something. Let me just say it. If you say something and I smile at everything, do not think I'm making fun of you because this is something is my nature. I smile. Sometimes when I'm uncomfortable, I smile. When I'm happy, I do the same thing. So technically, I kind of give you a mixed message, right? And I think I understood that when I was in Canada one time. I had a professor. She was the same way, and she talked about it, and then she said, "If I laugh, do not think I'm making fun of you." So I don't make fun of people or everything. Even if I we in my reactions do not because that's sometimes I do things like this. I move back and forth everything, and this is who I am. And if you meet me and then something I express ideas, and also one thing I do I like to make people think. So every time I have a chance to talk to people, so they can learn something about themselves. Sometimes I kind of I use exaggerations, not because I want to prove a point for myself. No, I want to make people think about what they're saying if they say something. Okay, today we're going to talk about what is psychology. This is something. The definition of psychology. If you take any, general psychology, they're going to give you a lot of definitions. And one simple definition I use because one of my favorite psychologists is William James. He is an American psychologist. He gave us simple definitions. See, psychology is the study of mental life. See, psychology is the study of mental life. So that even given the simple definitions, do not think the definition is really simple because same thing when you say when you study biology, when this is the study of life, do not think just that's it because you have to ask yourself what is life, and then that's when you actually think about it. Then you know, oh, that has more than I mean, more than I think about it. And then, or you can actually say psychology is the study of mental conditions or psychiatric conditions. That's the same definition we're going to use for our discussion. And also faith. We're going to talk about the definition of faith. This is something I often talk about if you're my Sabbath school class. I love to talk about that definitions because this definition when I was growing up, sometimes you always think faith is something you just have overnight. It, it's something you can actually prove. And then we're gonna go over that definition later on. We're gonna find out faith is something you don't have to prove. When you believe in God, you believe in God. You don't have to prove it. And also we're gonna talk about how to ways to help people with psychiatric conditions. And keep in mind, we're gonna talk about a little bit crisis. And then this is my my preference on things you should not be saying to people with mental conditions because even an example like for instance when like if you're talking with a patient even though you're laughing and everything you do not say oh you're crazy we do not use the word crazy even though when you use it it has we use a different connotation right because when you talk with your friend I mean, I've done it. I said, "Are you crazy?" And when I said that, I said, are you sure?" In many ways, you use it, but when you know someone has a mental deficiency, you do not talk. There's what you don't use to, to talk to that person anyway. And also, we're gonna talk about stigma. This is something we have to think about a little bit in our church. Stigma, years, even when I was growing up, there are things when you see you don't say anything about it, or you feel, or you say things to people when they have a problem. Because if someone has mental conditions, you don't say anything about it. You feel ashamed about it. And then when you do that, the person who has the problem, scared. They have fear of saying anything about anybody, anything about their situation. And then because of that, you're gonna have you to care because not too long ago now, the insurance allow people to actually use the insurance for if you have a mental problem to go directly to psychiatric unit. Before you gotta have a medical condition before they can send you up there. And also, one thing we're gonna talk at the end, the importance of talk about psychiatric conditions in our church. We have to be comfortable talking about it. And then we have to be able not to sing if someone trusts any of you and then say, okay, I have this problem, then the first thing you said, let's pray. Then we need to understand when you pray is talking with God. If someone has a problem, you have to be able to listen to what problem they have. That's one thing, listening what they have. And as the Christians, when we talk about faith, there's something I often said, Christian, we should be able to have empathy. That's the word we use in psychology all the time. Empathy, as a Christian, we should be able to have that. And with empathy, we'd be able to talk with people, like brothers and sisters in our church. Then, when we be able to talk with among us, we would be able to actually go outside and then be able to talk to someone else outside. because we have to be able to deal with the problem in our church. Okay, this is faith. This is what I was talking about earlier. Faith. This is a definition I use that definition: self confidence, self knowing that God exists without proof. And I know this is a hard one for some people to actually accept because we always want to show people that I have proof God exists. We always because we this is why in when I teach psychology, sometimes we talk about language, then we don't talk about the religion. People always try to prove something, and you don't have to prove your faith to anybody. Your faith is your faith. You can show someone that you have faith in God. You can tell them you have faith in God, but you don't have to prove it. You don't have to say, okay, I have this money, God gave it to me. No. You can actually say, because I believe in God, this is what God has done for me. You can show people that you have faith, but you don't have to prove it that you have faith. And then there's one definition, there's part of the definition that says faith shows the reality of what we hope for. It is the evidence of things we cannot see. And this is something we talk about all the time when we read able, you know, I love this is one book I love to read about faith. And also if I really want to show people someone who has faith, I can just go to the Old Testament and use Joe as an example. What has happened to the Joe because of his faith, this is what happened at the end. But one thing we have to keep on understand that faith, you don't have to show you have faith. You don't have to prove anything. I'm not sure. You don't have to prove anything because because if you have faith in God, you don't have to show. Okay, no. You believe God exists. God exists. No one cannot come say, okay, oh, I have this evidence or I have this scientific facts, everything. Therefore, if I can show it to you, there's no God. No, there's no such thing. Because this is why you have faith in God. You pray every single day so God can actually increase your faith. When you face things in life, your faith can also always be in God. Yes, questions. Yep, I mean, correct. Even the informations you there's information you can actually use the information to describe your faith. But because if let's say there was no such thing, you still want to believe in God because you're not gonna use okay because of this. No, you use that the information we have to show there is a God based on your faith. If someone doesn't believe it, that's the thing. If someone doesn't believe what you say, you should always say they don't have any faith because they cannot see what you see. Uh-huh. Mhm. Correct. Correct. Because when God, let's say God did something for me, I know God did it for me. I can feel it. I have proof for myself. But if I say that this same thing to Richard, let's just assume she doesn't get it. That doesn't mean God didn't do it for me. He just doesn't see it. So therefore, I don't have. I'm not gonna feel bad because someone doesn't believe something I said. But faith, because your evidence is your evidence to God, even someone that doesn't see it. Let's go to the next one. Okay, and then keep in mind we talk about faith. So we for one purpose to to have the application. I mean to apply what God has given, give us the doctrine. Because if we believe in God, we will be able to apply what God's has given us. When we talk about love, a lot of different things. If we believe in God, we will put that into applications, and that's when we'll be able to help someone else. Like if someone has a mental problem, okay. So in here we're gonna say problem, but like I said, it's better to say mental conditions, and that's more acceptable now. And keep in mind, let me give you that definitions or several definitions. When someone has a mental, psychiatric conditions, let's use stress for example. Everybody has stress, right? Keep in mind, stress becomes a problem when it goes beyond that affects your way of life. Because do not think because someone has stress, therefore they're sick. They have a mental condition. They need to go to the hospital. No. Same thing to think about. We're gonna go over that too. Someone can have a flu, right? They don't have to go to the hospital if they have a flu. But if they have a flu longer, like for a long time, so therefore they might have pneumonia. They might have different problems, right? That's when they're gonna have to go, to see someone who can actually help them. Same thing, psychiatric conditions. When you take, if you have someone, sometimes you have to do your own observation. Even observation doesn't mean you know what someone is going through. You have to ask because at the end we're going to talk about what you can say if you have any such problem. And then this is this is the key word. Function is there because whatever the problem that person may have is going to affect that person's functioning. That person cannot function every day. For instance, let me give you an example. Let's say I'm depressed, right? I'm so depressed at I go to work today, and then at one point I cannot go to work. Next thing you know, that stays longer, like a week, a month, then it becomes a problem. That's when you're gonna have to be able to talk with someone, and that's when you're gonna have to be able to deal with it yourself, if it's possible. But most likely, sometimes you need someone to be able to help you. And then, see, after you have a problem, you must have a recovery. Because, see, one thing I said recovery is possible, especially when you start tackle the problem early. When you have a problem, you do not hide anything. You talk with someone, then you have a better chance to recovery. If not, what is going to happen is going to increase. Then next thing you know, it becomes so severe, then you have to stay at the hospital. And then stay at the hospital when you have this problem is really serious. And then keep in mind, any psychiatric condition doesn't, it's not just one thing. It's a combination of many, many different things. And then I like what I said. I said condition is not just because of one event. I mean, there's research because there's crisis. For instance, let's think about a kid who actually moved to Wisconsin. Next, that kid may have a problem moving. When that kid moves, next thing you know, doesn't have any friends. Everything is going to leave behind. That kid cannot cope moving to a different state, a different city. And then over time, that kid becomes so angry, you know, because there's so many things going to happen. Angry, you know, not doing good in school, having problems, with teachers, even sometimes coming home in isolation, not talking with anybody. So all those things, you can argue this is the sign someone has a problem, a kid has a problem. First, it started with a crisis because the kid had a crisis. Parents moving, to a different state. That's a crisis to that kid, even though you don't see it. Then when all those things happening, next thing stuff has start happening. The kids might end up doing something to some kid when they're fighting, and then and then that can push that kid to substance abuse because a lot of patients we have, sometimes young people, sometimes they have two different problems. They have substance abuse problem. At the same time, they also have a mental problem. So then we have two units at Fairview for that. So think about it. When they try to treat two different conditions at the same time, and these are the problems we have to think about. And keep in mind, we always think about environment and genetics. This is one thing we talk about in psychology: nature versus nurture. This is something. It's a long discussion. If you have a problem or condition, the question they may ask you: is it caused by genetics or is it caused by your environment? And keep in mind, it's just like it's just like what comes first. See, in my definition, always it depends, because and also it always gonna be two. I mean, it's real. I mean, it's always two of them, always, not just one factors. And then let's keep talking about this one. Like as a grown up, if you have a job that also could be cause a lot of stress in your life. Think about it. Even though you're so stressful at work, that doesn't mean you have a mental problem. And keep that in mind. That doesn't mean you have a mental problem. But that can lead you to that can lead you to that. So, therefore, if you do have a problem like this, see, this is what we were talking about earlier stigma. You have to do the best you can to remove that. Because you got to have an environment where people can come and talk to people. And that's where the church comes. Among brothers and sisters, we should be able anyone should be able to come to us and start talking. Hey, how you doing? I'm going through some problem, everything. Talking to someone and listening to that person should be great. And that's something we should develop. That's something a culture we should have in a church. To have a culture where everybody can actually be able to talk to each other, and that can relieve stress from work. Because think about it, when you talk with someone, they're listening. See, when someone listening, they care, and that's what you see. You see someone cares about you. And let me give you an example. Like suicide, there's two different types of suicide. The active one, the passive one. See, the passive one is the ideal suicide. You have you're playing, you have things in your mind, but you have no plan to take your life. But you always say something, oh, I'm gonna do this, I'm gonna do that. And the thing is, I was talking one time with one of my students. They asked me, okay, do you know which one? And I said, you do not know which one is active, which one is not, because you only find out when something happened. So that's why I was talking with Richard earlier. Information, we have to have documentation. Someone can talk about suicide and they don't do anything about it, and someone might just say something. They actually say, "Okay, this is what I'm gonna do," and they actually do it. So those things can lead to the. So what if someone's going through stuff like that in the church? I should come. I should be able to go to Greg or Richard. Say, okay, hey, I'm going through some stuff, and then I have faith in my fellow. I mean, I have faith in my brothers and sisters. They're not gonna. I mean, I believe they're not gonna take my information and share it to someone else. See, that's the relationship. Just like we're talking with God, we love to pray. We say everything to God because we know God will keep everything. So the relationship between us should be developed where people can talk to to each other, so that can be helpful. Because talking is the first thing when it comes to psychiatric deficiencies. Because if someone can talk to you, they can help you a little bit. And one thing we have to learn how to listen. If Greg is talking to me, listen. Let that person talk, express himself. Do not do not say things you already know what they're going through. And never said, I know what you're going through. Let them talk, and then after they talk, you understand. Say, oh, I do understand what you're going through. Because you do not know. I mean, that's something sometimes we said, even though we don't mean what we said, do not never say, I know what you're going through. No. Listen to them, to that person talking. And sometimes this is how you're gonna learn from stuff. And keep in mind, stress happens many things, many different ways. Someone might a victim of a crime, and that's the same thing. And keep in mind, do not think each event affects everybody the same way. See, Richard or someone might approach them, they're just making an attempt to them, they're okay. So, oh, I can deal with that situation. But someone else, if something happened to them, even though nothing happened to them actually, you was just like, someone tried to do something that affects that person for a long time. And that person should be able to come to our church and be open to talk to anybody. I mean, almost anybody. In reality, I mean, we know that's not anybody, but almost, because as a Christians, if you have faith in God, you should be able to apply that love God gave us. Okay, this is one thing we have to keep in mind. Okay, I was talking about recovery earlier. Keep in mind, we all have experience of mental conditions. See, I like oh, yeah, 1 in 5 people in the United States experience that. I mean, you can actually take. I mean, that's a lot. It is, and do not think it has to be severe psychiatric conditions for that to for anyone to care. No, it doesn't have to be like that. And then this is one thing I like I said earlier, early engage in support. We have to be able to provide that. And as people that should be something in ideal church, okay, perfect church. Let's say perfect church. That should it's easy thing to because if we believe in God, Jesus Christ, we know what Jesus did. Always talking with people, always sitting with people, never prejudge other people. If we don't do that, people would be able to support anybody with any. deficiencies. And that early engagement support, that kind of is going to help that person. That's something we have to think about. Okay. And then what I'm gonna do now, I'm gonna play a video just so they can talk about more about what psychiatric condition really is, because I'm not gonna talk about anxiety, OCD. I'm not gonna talk about it because I'm just gonna because we're not gonna focus on one disease. We're just gonna talk about overall what mental illness really is. So with that, so we can understand how to help people. Because as I said earlier, psych is a way if you can learn how to help other people. Because if you learn what someone else how they feel about something, then you can help that person. And then you can help your fellow man because you can actually say, okay, guys, we have to be able to listen to other people, try to learn about someone else, their personality, their problems. And I know this is a different um, conference because I was thinking about to talk about perception, and I said no. Then I changed my mind because I said maybe next year if we do it again, then I will know what to talk about. But what we're gonna listen now, just listen to it. Then after that, you guys can ask questions because I like people to be engaged.
OCD, PTSD, and related psychiatric disorders. We're going to be talking about psychiatric disorders that are related to nervousness, rumination, and related somatic complaints. We're going to be talking about diseases that are listed on the left here, and this is a general picture of a person expressing anxiety that can be related to any and all of these disorders. Let's get started with generalized anxiety disorder, sometimes abbreviated GAD. The prevalence of GAD is 5 to 10%, and it occurs twice as often in women than men. Generalized anxiety disorder is essentially excessive worrying and anxiety for at least 6 months, so that's one of the criteria for it. People typically worry about school, grades, jobs, how much money they have, relationships they have, life events, and other parts of life. Worry about anything and everything. The pathophysiology is essentially a disrupted functional connectivity of the amygdala and its processing of fear and anxiety. The amygdala is a part of the brain involved in processing fear and anxiety, as that definition implies, and it's shown in that image on the right there. To be diagnosed with generalized anxiety disorder, you need to have at least 3 of the following symptoms: restlessness, easy tiring, problems concentrating, irritability, muscle tension, and problems with sleep. These symptoms, like many of the other diseases on this list, need to interfere with your daily functioning for diagnosis. Treatment for GAD can be psychotherapy, like cognitive behavioral therapy, CBT, as well as pharmacotherapy, SSRIs, SNRIs, buspirone, and short-term benzodiazepines. You never want to prescribe benzos for life, but for a short-term fix, they might be appropriate. And you'll see that many of these treatments are the same for all of these diseases, the same psychotherapy and the same pharmacotherapy. So we'll see this list quite a bit. Next up is specific phobias. Specific phobias have a lifetime prevalence of over 10%, also more prevalent in women than men, 2-to-1 ratio. Specific phobias are an irrational fear of a specific object, place, situation, or concept that needs to occur for at least 6 months. Oftentimes, the fear in a specific phobia is described as being out of proportion to an imminent threat. So a fear of spiders, for instance, elicits a response that's way out of proportion to the actual threat that spider poses to a person. The fear, again, needs to interfere with daily functioning in society. The exposure to whatever object, place, situation, or concept elicits immediate fear, and removal of that object, place, situation, or concept reduces the anxiety almost immediately. Fear in specific phobias might have developed from related trauma. Perhaps somebody had a near drowning accident and is now afraid of large bodies of water. That'd be an example of fear of water that developed from related trauma. Social phobia is one subcategory of specific phobias that involve fear of embarrassment in a public situation. Similar, but not quite the same, is agoraphobia, which is fear of public places due to the lack of the ability to escape. These people essentially are afraid of unsafe environments. So those are two specific phobias that are worth knowing: fear of embarrassment, social phobia, and fear of unsafe environments due to the lack of ability to escape, agoraphobia. Treatment for specific phobias are CBT, and also some scheduled meds like SSRIs and SNRIs can help. You can also prescribe meds to be taken as soon as a patient has an episode of intense fear, and that can be beta blockers or benzodiazepines. But again, you don't want to schedule benzodiazepines for long term. Next disease is separation anxiety disorder. This is an excessive anxiety regarding separation from home or from people to whom an individual has a strong emotional attachment. In children, it's separation anxiety disorder when it occurs for over 4 weeks. In adults, it needs to occur for over 6 months to be separation anxiety disorder. Separation anxiety may include anxiety, fear, and distress when separated, reluctance to leave home, work, or school, or worry about harm to the attachment figure. So a child that is overly worried about their mom getting hurt could be a manifestation of separation anxiety disorder. And again, symptoms need to cause dysfunction in that person's daily life. Again, treat with CBT, family therapy, and possibly SSRIs. Similar anxiety during normal child development occurs physiologically, and this is normal. This is not pathologic. This includes stranger anxiety that occurs at 6 months in the development of a child. The child begins to fear people that do not look familiar or strangers. And separation anxiety normally occurs at 1 year in a child's development. A child begins to worry about being separated from mom or dad or whatever other attachment figure. Next up is panic attacks. Panic attacks have a prevalence of 4%, also more common in women than men. Panic attacks are sudden periods of intense fear that may include palpitations, sweating, shaking, shortness of breath, numbness, or feeling that something bad is going to happen. Essentially, intense fear. You need to have at least one of these attacks to be diagnosed with panic attacks, and that makes sense. And because you have these attacks and you've had them in the past, you have a constant worry about recurrence of these attacks. Other symptoms might manifest in panic attacks, and this includes trembling, unsteadiness, depersonalization, palpitations, and even pain in the abdomen or chest. It's important to rule out medical etiologies when trying to diagnose panic attacks. You want to be able to rule out hyperthyroidism, atrial fibrillation, pheochromocytoma, and drug use, including use of amphetamines and sympathomimetics, to ensure there is no medical etiology and that person is actually having a psychiatric panic attack. Treatment for panic attacks is similar. You can use psychotherapy like CBT. You can also use pharmacotherapy. SSRIs are most commonly used. You can also use benzodiazepines as a short-term solution. And again, same common theme. You don't want to prescribe benzos for long-term. People can get addicted and require more and more of them. So benzos can be a short-term fix. Somebody pops a Xanax when they feel a panic attack coming. Next up is OCD, obsessive compulsive disorder. Prevalence here is 2 to 3%, equal between men and women. Obsessive compulsive disorder is composed of obsessions and or compulsions, and we'll be defining both of those. Obsessions are recurrent thoughts that persist despite trying to ignore them, and compulsions are explicit rituals that either reduce anxiety or that patients feel they have to perform. So if you have one or both of these, you might have obsessive compulsive disorder. OCD is comorbid with many other psychiatric disorders, especially some that we're talking about here. Many of the anxieties, depression, bipolar, and OCPD. So oftentimes people have OCD with other disorders. Quick note how to differentiate obsessive compulsive disorder from obsessive compulsive personality disorder is that one of them is egosyntonic and the other one is ego dystonic. Egosyntonic means that it feels good, means that you're okay with yourself when doing that. That's OCPD, obsessive compulsive personality disorder, is egosyntonic. OCD, obsessive compulsive disorder, is not egosyntonic. You don't feel good about it. You don't want to constantly wash your hands every time you use the bathroom. You don't want to have to wash your hands 20 times in a row. You don't want to have to check the locks 50 times before leaving the house. These are things that disturb your daily life, and it's not egosyntonic. So that's a quick differentiator between OCD, not egosyntonic, and OCPD, which is egosyntonic. Treatment for OCD is similar to the others, psychotherapy, including CBT and SSRIs, as well as one tricyclic antidepressant, clomipramine, is shown to be a little more effective, but primarily SSRIs and CBT. There are some other disorders related to OCD. These might be like a more specific type of OCD. This includes body dysmorphic disorder, which has a high prevalence in women, also higher in patients that are prominent at derm clinics or cosmetic surgery patients. In body dysmorphic disorder, people have perceived flaws in their physical appearance, and they often act upon those flaws. Excoriation disorder or compulsive skin picking is another OCD-related disorder. This can present like we saw in that picture on the previous slide. Let's go back to that real quick, where a patient has all these lesions all over their skin where they picked their skin. And again, that's an ego dystonic OCD disease. That is not something that a person wants to do. They feel like they have to pick their skin. Maybe they feel like they're infested with bugs, but that's excoriation disorder. Next is hoarding as an OCD-related disorder. In hoarding, a patient cannot discard their possessions regardless of the value of their possessions, which largely leads to them accumulating trash, and you can treat hoarding with specialized CBT. Trichotillomania is a hair-pulling disorder. You can see hair loss like you see in that picture on the right here. Person pulled out their hair in a specific area, and it leads to showing of the scalp on their head. Trichotillomania, you can treat that again with specialized CBT, with habit reversal training, SSRIs, and some atypical antipsychotics might be useful.
Hey, what do you guys think? Any questions? Bec- Oh, CBD is, yeah, it is a treatment we use because this is something they didn't use many years ago. They used to think that was a bad thing, so now they actually use it. So let me see if I can show the way they do it is just like there's a okay, let's just say there's what they actually do, they kind of reset your brain because they connect, there's a circuit and they put something in your head, everything in the lab, and then they actually release some electricity into your brain. They kind of reset it, and then it does help for like 50% of the patients, but not for everybody actually. And this is something actually I saw they actually did it to two patients of mine a couple weeks ago. Then I was there, and then it happened so fast. Just like you go to the lab, they have a cast over your head, everything, and then they release the electricity into your. It's like a shock, but just a little something really small. Yeah, yes. The each thing is better. Uh-huh. Now it's more regulated, and then it's useful for some patients. A little bit. No. Actually, I never actually. No, I don't think it does because it's really safe. It's like really quick. like less than 1 minute. Hmm? Which one? Okay. Those medication there. Okay, keep in mind those medication. These are just one treatment you may use because most likely we use two different kind of treatment. Psychotherapy, where they actually talk therapy. They will also use medications, which is CBT is part of medications actually because you have to have an order for that patient to actually go under that. Yes. Oh yes, because not now they do because before a lot of stuff with with mental health there was no insurance directly. Now they actually do cover by insurance. Yes. Uh-huh. Because all my some of my patients actually at Fairview same thing. Yeah. Yeah, engagement. Yes. Yeah, correct. But see, that is the environment we have to create, like trust in the environment. People can actually, when they have a problem, they can come to. Let's say I have a problem, I can come to Greg because I'm comfortable to. I mean, they would pick one person, not anybody, because you have to select someone you can trust, someone you feel comfortable with, because you're not gonna sell your problem to anybody, and that's fine. That's it. Hmm. Correct. Hmm. Oh, yeah. I mean, there are side effects. I mean, because even the medication they give you, there are side effects. Sometimes they may use one, and then that side effects cause another disease. Well, not disease, another situations. I mean that happened because this is why you have to talk to. This is why when I talk, I talk with my brother once. I said, when you go to a physician, this is your counsel. You have to talk to that person. Let that person know how you feel about things, the medications. If you take the medication, if there's a side effects, you have to call them, let them know before you go any further because sometimes the side effects that might affect your kidney, other problems. Mhm. 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 Back to the psychiatric unit. Uh-huh. Yeah, but I can tell you. Okay, let me tell you. Let me give one example. Because I have a patient. But I cannot give, because privacy, I cannot give you any names or anything. You know, the person said, "Oh, Stephen, this is my fifth time between June and July. So you keep coming back, like you were saying, keep coming back. This is keep coming back." But when it comes to psychiatric, conditions, if you don't have, the environment, to get, to recovery, it is gonna be hard to recover because when you go home, you got to have the support from from the loved ones. You cannot recover from psychiatric conditions just by yourself. You gotta have the environment, like support from your the loved ones. It can be anybody, caregiver, mom and dad, husband and wife, kids. You got to have that. And this is what we have in Fairview. And every time you go to a psychiatric unit at the hospital, what they do, they create the environment for when you come in so you can recover. That's what they do. We call, in the environment. The environment you cannot create when you go home. So therefore, if you do not have that environment at home, you're always gonna come back to the unit. Yes. Mhm. They can call you. Yeah, no, no. I agree with you because if you have someone, let's say you do, let's just assuming Greg has mental, psychiatric conditions, then every time if you have someone you can call, because it doesn't have to be someone at your house. So if you have someone you can just call to talk every time you have an episode, I mean anything, any problem, you can talk to. That can be helpful, and that person can actually tell you when to go to the hospital and when not. This is something we all have to think about it, helping each other, because that's just the only way you can actually help someone else with mental condition or physical conditions. Yes, just sec. y- y- Without a psychologist, yes, I mean usually that person is going to be a psychiatrist, so they study medicine and also psychology, so they can do too. But if they don't have I mean if they don't have the skill, what they usually do, they're gonna send you to a psychologist, you know, and then to help them to see to add, to say, okay, do you have a situation or not? And then another, this is when they talk about phobia, this is something we you guys can hear people have phobias. There's so many different ones. And some of them, one definition they give it is irrational fear, because the reason they say irrational fear, it doesn't make any sense. Let me give you an example. Let's say someone has a fear of the lights, right? Because they don't, that person stay on the dark. So technically, that person, when people see it, it doesn't make any sense, right? But that person has a fear of light. And I can tell you there are people who actually have fear of the sun. So those people, during the day, what they actually do, they stay in the closet. I mean, it's not a lot of people, but there are people like that. They stay in the closet, and you can say phobia or fear. When they have such problem, is very very, because when if they go outside, they have like they like the anxiety. They're gonna like a heart just don't stop. Same thing when they talk about panic attacks. Like there are people who have that problem. It is really, really serious situation when you have that problem. There are people who cannot fly Okay, even though you have money, you may think, when they see you driving from here to California a long distance, right? And you say you don't, you cannot get your ticket, airline tickets. It's not always the reason why. The reason why sometimes they have, they have the anxiety, they cannot fly. Yes. Correct. Mhm. Correct. Yes, because God put us here to help each other. This is what we say when we have faith. When you apply, the doctrine of God, you can help someone else. Because when you help someone else, it's not just you do it. As we know, when Jesus said you do something for someone else, when God comes, He's gonna say, "You did this for me," uh because we represent God. uh Correct. Mhm. Correct. And then the purpose today is just we try to make an awareness of psychiatric conditions in our in our church. So more you know about this situation, better you can help out. Because when you know someone has a panic attack, this is a serious. This is a serious something. This is serious stuff. If you understand it, first you're not gonna laugh, and second, you'll be able to not have no fear, because one thing, let me tell you something. When people with mental conditions, they're not violent. People always say when you watch the news, something happened. They always say, like, "Oh, he has a mental problem," and it's rare people who have mental problem actually do bad things to someone else. They're more victims than they actually do things to other people. So keep in mind when you watch the news, do not. I know that's the perception we have. Oh, he has a mental problem. What condition does he have, or that person have? Then that's not the case in reality of it, because those people, they're victims because they cannot take care of themselves. See, I have a patient who actually, we're gonna go over that. Not OCD. The person has serious problem. He's been in the hospital for almost 2 months. See, usually you come in after a month, less than a month, you be able to go home. Here's the problem: the person doesn't have a place to go. Keep in mind, because the stigma we have, when people have those conditions, we give up on them. Their parents give up on them. Keep that in mind, because okay, yes, I can say yesterday I have a patient. He was crying, saying, "My mom doesn't come to see me. They don't call me." And try to understand. Do not blame the mom and dad, because it's hard for them to accept, to understand. Because when you see someone has a mental deficiency, physically, you see most most of them, there's nothing wrong. You don't see anything wrong, because physically it's hard to accept that person has a problem, because our culture, it's hard, because see, look at you fine. But if you let someone who has a broken leg, is easy. It's, oh, she has a she has a I can sympathize. I can say, oh, but when you have someone who has a mental deficiency, it's kind of hard to actually accept it. You can say now, because Facebook, because social media, they talk about it. Now people even accept it a lot more than before, because panic attack. Let me give you one example. There is one basketball player who actually got drafted once. He had anxiety. When he got drafted, actually he played for Wisconsin University, I believe. He got drafted. I was excited. I said, let me see if they're gonna let him play, because to play you have to be able to travel. He cannot fly. So if there's a game, let's say you in Texas, there's a game in at the Twin City. You have to drive from Houston, let's say Houston, to here within 2 days. Then after that, you have to keep going back and forth everything. And even if they got drafted, it was a great thing. Guess what? After months, they start talking about it. They say, "Oh, why can't you just fly? It's so weak in mind. It's just weak. It's just weak. Why can't you just fly? Get over it." And you see, it's easy for us to say when people have those conditions to get over that. I mean, get over that because you're just weak mind, and that's not the case. And that's something we have to be able. We need to start to understand to be able to help people. Like I know some of you work with the homeless populations. They do have a lot of problem like that, and you need to understand those people. Sometimes people cannot, like we talked about earlier, their situation they cannot work. Even though you give them a job, they cannot go every single day. So think about it. If I give Greg a job, he cannot. Now he cannot go. Then he got fired. I said, Greg, I help you. That's what I'm thinking about. I help you. Then you mess everything up. No, we need to think a little bit to think about why someone does something like that. Because what that person did so abnormal, what did you do it? Try to understand first before we make any judge. Before we try to help out. If I know what Greg's situation, I can help Greg a lot better. And the same thing when you hear someone have OCD. This is something I know most people hear that OCD is something. It is serious situation, and they're different kind. Okay, because when you see someone, they cannot function into society because what they're going through, what they're going through. So to function, this is what we need to understand. People with psychiatric conditions, they're not gonna they're not gonna just cure and everything go away. What we do to help them manage the situations. See, your situation once you can manage this, you can manage it, you're fine. So if someone is schizophrenic, they hear voices, right? And there's a point if with therapy, medications, they can be able to manage the situation. Once they manage it, they'll be okay. They can function in society. That doesn't mean they don't hear anything. Keep that in mind. If you do, if you do have if you have severe depression, that doesn't mean you're not going to be depressed. Now you have a way to manage the situation. And like I said earlier, to manage the situation, it comes with your environment, support system. And the church like this, we should be able to learn how to do something like that. Supporting other people is a good thing to prevent any severe mental deficiencies. And it is today we're going to try to understand, to think about it. Say, okay, even when you go home, you can go online, read about it. You always ask yourself questions. How do I help someone else? Someone I know, okay? Because someone you know close to you at your house who have that problem. Now I need to learn how to talk to him. If we can do that, then we'll be able to help a lot. Yes. Yes, this is what okay, friends and family members. This is one thing I was talking about earlier. Because your friends, your family has can make a big difference. Because you cannot do things by yourself. Even though sometimes we think, "Oh, I'm so smart, I can do a lot of things by myself," and that's the illusion we have. That's not reality. We have to help each other. And keep in mind, anybody can actually experience any mental problems. It doesn't pick say, okay, I'm gonna pick one person, I'm gonna pick this female or this. No, anyone can actually, because you never know, because something can happen to you at work, and that can cause problem. And the question is, how do you help someone? This question I keep asking, how do you help someone else? First, you have to recognize the sign. See, because when you see someone at your house or at the church, you just say, "Hey, how you doing?" And do not push yourself to someone else. If you say, "How you doing?" The person say, I'm okay." Oh, can we talk? So you say, "No." Let it go. That's fine. And do not take it. Do not take anything wrong about it. And if the person allow you to talk to them, this is what you can actually do. You can help them. Then you can actually look for information. Then you can actually, okay, this is my, Steph and I have a friend who has this problem. What do you think I should do? Or Greg, I have that friend. He has this problem. What do you think I should do? Greg, oh, I know a number. I can give it to you. Oh, I can go online and find the information for you. And talking with, like I said, talking with someone is the main thing. You have to know how to talk to people. One thing I said earlier, listen. We have to listen. Let the person express himself. Then when you listen, you learn more about the person. And then to learn about it, don't just listening and then ignore what they're saying. And then when you can actually do things like that, guess what? Like we said earlier, we talk about God, faith. God said we got to have compassion, right? If we do have those kind of stuff, those kind of traits we develop because of God, a fear of God, guess what? We can actually apply that talking with people. Because if we have compassion, if someone is going through some stuff, they're talking to me, I can say, okay, I can talk to that person. And another thing, let me say it before I forget. When you talk to someone, do not talk down to that person. Don't say, Greg, how you no, no, no. Greg is not a kid. Don't talk to Greg like that. Say, Greg, how's it going? It depends on the person, the age. You have to look. Do not talk down to that person because you don't want him to feel worse, like, you don't want to add anything to what they already have. So do not talk down to anybody. And then if a friend, okay, if someone showing any kind of mental deficiencies, and they actually, now they actually want to talk to you, okay? So what do you do? How do you support that person? And this is one thing we need to think about. And then when the person is talking to you, you need to find out, are you okay? Okay, you find out if they are getting something, if they're what. Okay, you tell me you have this problem. What do you do? I mean, are you doing anything about it? Because you don't know. Because someone may have a problem, they don't think they have a problem. Okay, let me give you an example. When people go to the psychiatric unit at Fairview, I can give you that example. One thing they want to prove to themselves, they're not crazy. See, that's one thing they want to prove. I'm not crazy. See, you come to, that's all you're thinking about. You're not crazy. And then you what you do, you waste, I mean, you spend all your time try to prove to people you're not crazy. Then you ignore the situation you have already. So you need to understand that their needs. And then once you know understand my needs, then you can connect me to someone else to help me. And then one thing I like what I have on the second one. It says always expressing what your concern and support to that person. Always do that. You need to express that you care. Oh, I'm sorry you're going through that situation. And then you listen to them. And that's the only way you can help the person. And then when you do, you're looking for ways to help. Okay, you can go to once you understand the problem, then you can ask questions. And then one thing I said, okay, asking questions, listen to ideas, and then always respond to what they're talking about. Do not add anything. And then another thing you can actually do, you can actually offering to help if you can. Helping doesn't mean you're gonna solve their problem. Helping doesn't mean you're gonna, have a treatment plan for that person. No, you can actually send the person somewhere to find what they need. And then, like I said, friends, family, you always gonna include in your plan because if you have a problem, you need to include other people to help you out. It doesn't have to be everybody. Keep that in mind. Even though the person doesn't want you to be involved, it's okay. Don't take that as a negative because sometimes you don't want too many people in your situations, and that's then we should take that that's okay. And also teach yourself about the situation. Try to understand about the problem, and then the last one, treating people with what respect. People with psychiatric deficiencies. Treat people with respect, compassion, and empathy. See, those three things, as a Christians in the church, we should, an ideal, I'm not saying everybody does, we should have those three things: respect, compassion, and empathy. Because based on in our doctrine, the Bible, everything we do in the Bible studies, always try to teach us things: respect other people, have compassion and empathy. And that empathy, we all people now people try. I think people understand empathy a lot better than before. See, empathy, you put yourself in that person's shoes, so you can understand. Okay, do not think you're gonna feel the same way, the same thing, so you can understand what they're going through. Then you can help out. And did you know? See, this is one thing I think I said earlier. See, 1 out of 5 people suffer some type of mental deficiency in the United States. And okay, this is one big number, like 10.2 million people. Think about it. Addictions, let me talk about a little bit about addictions. So addictions, I used to talk to people, young people, and then sometimes I do the discussion for the sake of it. And when I say addictions, some people always think addiction is not a disease. Okay, nearest to everybody. Addiction is a disease. Let me explain. If someone, okay, let's think about it. Someone drinks something, okay, it's not a choice, for them to have addictions. It was a choice to drink, okay, but they didn't go and say, okay, I'm gonna go up there and drink so I can so I can have addictions. Addiction is the outcome of what you did, but addiction is not a choice. No one chooses to have that disease. No one actually take medications. Next thing you know, they have the addictions. They cannot stay away from it. Okay, and keep in mind the addiction. When you have the addiction, when someone addicts, addictions is serious. When you see people, let's use alcohol, the simple one we use. People they drink all the time. they cannot stay away from it. And you say, no, 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 they're weak and no, no, no. Drinking is a choice, but the addiction they have is not a choice. Nobody, you'll never find people just go, let me go outside so I can have a disease. No, I can do something, what I did lead me to have, cause me something, but I didn't choose to have an addiction. So I know it is a new thing. People always say you do have a choice. You can just choose not to drink. Yeah, you can choose not to drink, but you not choose not to have addictions because you drink, then the outcome of it is you never have addiction, then you're sick. Same thing, you eat something, you didn't say you want to, sick. You eat, next thing you know, what you eat caused something. Then now you have a disease. And then another, like in the homeless population, this is something is really serious among the homeless population. Even that number I use, 26%, I think is more. Is And then in jail, this is one thing. This is even in jail. I talk with some people. Even though we say 64.2%, it is there's a strong belief. There's the population. I mean the percentage is really high in prison because when you actually stay in isolation, it will lead you to any kind of mental deficiencies. Even before most of them they tend to have problem even before they went to jail. And even though when I say even nearly 60% people some kind of way they actually have the experience of mental deficiencies. And the problem is they do not have the access. See, that's what we were talking about earlier. You don't have access to help you. Any kind of treatment, anything. And that's the main problem we have in society. Not just today. Keep in mind, if we talk about today, yes, but the problem always keep going up, always there. And this is something as Christians, if we a relationship, we create an environment in our church that can be helpful for a lot of people. They can come in, they'll be able to talk to people. It could be one person, and they'll be able to manage the situation. When they come in, we're not going to add to their situation. Why? Because we understand it. And second, because we apply what God has given us. And this is a serious situation. Even though we talk about it today, keep in mind this is a serious situation in life. Okay, now before we talk about crisis, I mean trauma. See, trauma can cause by many different situations. Because, like, if there's a hurricane, for example, you lose your house. Keep in mind when you lose your house, that can cause trauma. See, some people, when they lose their house, they have no hope. And that's when we comes in. See, as Christians, if we believe in God, we have hope. Even though we may have crisis now, because of God, that can help us not to go beyond where we actually have trauma. Because when you have trauma, you go beyond. It's hard to go back. You need to have someone to help you to go back. And this is something happening. This is something that keep happening many. You can say all the time when you watch the news, because when you hear people lose what they have, think about it. See, try use your empathy skills. When you put yourself in that situation, you lose everything. You have nothing. Think about it. You're 67, you lose everything. your house, and guess what? The house has no insurance. And then you take, you work all your life, then you pay off everything. Now you lose. Now one hurricane, then you say, you know what? I only pay for it. I didn't. I'm not gonna pay. I'm not gonna get insurance this year. And next thing you know, boop, everything's gone. Or you send your payment late. There's so many reasons. Okay, I just create one, but there's so many other reasons that can happen. When those things happen, what do you think happened? Serious situation. People just go beyond. Now they are beyond where they're supposed to be, and they cannot function. So if they cannot function, what do we do as Christians? So we're gonna watch that video so we can actually understand what trauma really is. It's only 10 minutes.
Hello and welcome to this video presentation of Understanding Trauma, the Cause of Chronic Conditions. My name is Scott Musgrave. I'm a physical therapist, chronic pain, and human performance specialist. And I've created this video especially for anyone who continues to suffer from a chronic condition like anxiety, depression, chronic pain, or post-traumatic stress, so that you can better understand what's really going on. Now, understanding how your brain reacts to trauma, well, it turns out is the key to understanding how trauma impacts your body. So the first thing we need to do is really define trauma. What is trauma? The real definition of this may just surprise you. Okay, listen, we can all agree that getting into a car accident or breaking an arm or a leg, these certainly constitute traumatic experiences in life. But that really only tells part of the story. The key to defining trauma lies within every one of us, in something we all share in common. And that something is our survival instincts. So how do our instincts define trauma? Well, our instincts of survival ultimately define trauma regardless of what we think about the event itself. See, it's a chemical thing. There are certain parts of the brain that live beneath or outside of your conscious awareness, and they react to these life events. When they produce the chemistry of trauma, your body is pushed into a traumatic reaction. That's what we're here to learn about. So here's a new definition of trauma that's championed by renowned neurologist, traumatologist, author, and international speaker Robert Scare. And that is that trauma is defined as any negative life event that occurs in a position of relative helplessness. Think about that statement for a moment. Relative helplessness. So when the human brain experiences trauma or any negative event in a relative state of helplessness, an instinctive process of protection is engaged. And it turns out that the key to understanding trauma is finding out how the human brain responds to helplessness and how this helplessness engages these natural instincts of survival and what those natural instincts of survival do to your body. So this is how it works. When your brain experiences any event with a combined negative consequence and a relative state of helplessness to that event itself, then instinctive neurochemistry turns on the survival strategies of fight and flight reactions, which are then sent throughout the body. And these fight and flight instinctive reactions of protection serve to help us survive the event, which was ultimately perceived as a potentially life-threatening situation by our brain. So we can all see the benefit of having an instinctive or automatic part of our brain constantly assessing for any life-threatening situation and ready to take action in the event that we experience something like that. But the trouble with trauma is that the human brain has a way of learning to associate many things, even safe things, later on with the actual trauma long ago, and then can re-engage the neurochemical processes of protection over and over and over, often long after, years after, the actual threat has been extinguished. In point of fact, it's important to understand that this happens to all of us all the time, consistent with the basic form and function of the human brain. Now, most of our habits, they're actually formed in exactly the same way. And I want to go through some of the habits of trauma with you, because I think you'll find that many of you have commonalities of symptom patterns or presentations within this grouping of habits. So the habits of trauma include chronic pain, depression, anxiety, fear, tension, anger, post-traumatic stress, dependency, and learned helplessness. Now, these interrelated habits, well, they're common patterns that are associated with trauma. They're also common patterns when we're dealing with chronic conditions. And the habits of trauma, well, generally they lead to patterns that have dramatic physiological impact in our bodies and ultimately dictate our very own quality of life. The travesty for most trauma survivors is that the neurochemistry of helplessness is re-engaged so often that maintaining a state of fight and flight becomes a habit. And this results in a myriad of chronic conditions emerging, each having its own doctor, its own medicines, and its own empty promises. So to make matters worse, most of the reactions that have resulted in these habits, well, they were actually false alarms. So now we can understand how the brain responds to trauma, but what does that have to do with how the body reacts to trauma? Okay, listen, the part of your brain that controls all of your survival instincts, see, that's called your autonomic or automatic nervous system. It also controls every system in your body, including your nervous system, cardiac system, digestive system, circulatory system, respiratory system, reproductive system, your excretory system, your muscular system, your skeletal system, your endocrine system or hormone balance, your immune system, and your integumentary system. Take a look at that list. Chances are your symptom patterns are included. But this autonomic nervous system, it also micromanages the interrelationships of all of these systems, the tissues and organs that comprise these systems, and how these systems work together to sustain your life. That's 24 hours a day, 7 days a week, no breaks. So when the autonomic nervous system engages the survival instincts of fight and flight, every single system in the body receives instructions to be prepared for critical action. Now, interestingly, if you're able to evade the real or perceived threat that initiated this traumatic response in your brain, then your autonomic nervous system turns off the survival instincts of fight and flight. This allows your body, your physiology, to return to balance or homeostasis. That's the place where true healing can really occur. But what happens when you can't or don't escape that threat? Then your brain or your autonomic nervous system becomes frozen in a state of fight and flight, still considering the trauma to be an active threat to your survival. And when your autonomic nervous system freezes in the state of instinctively driven protection, fight and flight, kind of just like this iceberg, the real problems are much more than you can see above the surface. The real problems live underneath the surface, inside every single system within your body. Now, when you're frozen in a fight and flight instinctive pattern of protection, your brain drives your body hard at full speed, kind of like this race car. The thing about that is, our body isn't really built to sustain that over the long haul. So, over time, as expected, your body starts to break down. And this results in chronic conditions that show up in multiple systems within your body. Look again at this graphic of the habits associated with trauma. Chronic pain, depression, anxiety, fear, tension, anger, post-traumatic stress, dependency, and learned helplessness. Okay? And these can become habituated within your brain, your body, and your very life. Now, the habits of trauma, they generally lead to patterns that have dramatic physiological impact in your bodies, and they ultimately dictate your quality of life. And the list of chronic conditions that result from the autonomic nervous system becoming frozen in a state of instinctively driven fight and flight protection, consequently instructing your body to operate at this full speed critical action alert, well, they just might surprise you. So here is a partial list of traumas so that you can better understand the life consequences of living frozen in a state of instinctively driven fight and flight protection. So you can see how your history may have culminated into this state of fight and flight protection being activated within your body and driving your chronic conditions. Here's that list now. There are many things on this list that you may or may not have considered to be traumatic in the past. I would suggest you just pause this video now and read through this list and ask yourself how these events may have been a part of your life's history. Now, let's explore an example of how an old trauma can re-engage the fight and flight instinctive mechanisms of the autonomic nervous system today, long after the threat is no longer real. So consider getting in a car wreck at an intersection on your way to work, and then reliving the experience of the accident, the fear, the anxiety, the stress, every time that you go through that intersection. Or as another example, think of how your body reacts just before you step in front of a big crowd to give an important speech. In both of these cases, most of us react in predictable patterns that include increased heart rate, blood pressure, shortness of breath, clammy hands, dry mouth, feeling like you have butterflies in your stomach, tension, stress, or recurrence of pain patterns, the inability to focus or make decisions, clenched fists and tight jaw, digestive problems, including irritable bowel syndrome, and many others, avoidance behaviors, and emotional reactions, including anger, fear, anxiety, and depression. Now, how can all of these reactions be universal and predictable for all humans? It's because they represent the impact of the instinctive fight and flight responses of protection within the human body. And every time that these reactions become re-engaged, they're actually reinforced. And this results in the formation of life habits over time. Perhaps this picture best exemplifies how our brain reacts today when exposed to the memory of an old trauma. Even when we consciously understand the experience is not currently or directly threatening our lives today. Look at this picture for a minute and just think about how it makes you feel. You can probably remember what you were doing when this occurred, where you were, the people that were around you, the responses of those people, the looks on their faces. You probably have a very good recollection of many events that were associated or surrounded by this event itself. So now we can understand how trauma impacts our brain, how that resulting fight and flight instincts take control over our body in order to help us survive the threat, and how constant reinforcement of this protective patterning results in the formation of life habits. So it seems like the next question has to be, what can we do to break the cycle of trauma? Well, cutting-edge neuroscience has led to a remarkable discovery of a very simple treatment application that actually changes the chemistry of trauma within the autonomic nervous system, right at the cause. That's called Associative Awareness Technique, or AAT. And it's a remarkable treatment process that's specifically designed to promote balance within the autonomic nervous system. AAT is a treatment system that's built upon new discoveries in neuroscience, and it represents a much-needed change from the old thinking in medicine. And best of all, most of the AAT treatment system is self-applied once you've learned the techniques. You can perform them on your own anywhere. The first step is called reflexercise, and it's a simple, effective, self-applied step that can be readily implemented within minutes of downloading an instructional manual. It represents a significant breakthrough in medicine, as reflexercise promotes a neurochemical trend toward balancing the autonomic nervous system reflexively. That means automatically, even in the face of old, long-habituated traumatic responses. And reflexercise allows all humans to self-direct or train their own instinctive reactions to trauma. So if you or a loved one suffer from trauma, chronic pain, anxiety, depression, or post-traumatic stress, then reflexercise is the first step to actually extinguishing that old threat and establishing a renewed sense of neurochemical and therefore physiological balance or homeostasis within your lives. Don't allow mistaken threat responses or false.
And this is what I was talking about, trauma. This is since we it's almost 8 o'clock. We're gonna stop after this night. So trauma is something you don't choose one event that can cause trauma to one person. Keep in mind, many things can happen. You can actually experience trauma by watching the news because when people see things like it depends on the person, you feel like you're losing control of your life. Things are happening. And the question you can always ask yourself, what do you do? And this is the same thing on when I talked earlier. You have to be able to talk to someone, your friends, your loved ones. You have to pick someone you can talk to. And like I said earlier, the person you're gonna be able to talk to, someone you can trust. Someone is comfortable you can talk to. Someone you know when you talk to them, they're not gonna go and say everything to other people. And this is something we have to keep talking about. Psychiatric conditions in society today or the past in our life, we have to talk about it. And we have to be able to do it in the church. And we have to be able to use our compassions. We have to be able to respect other people. And we have to be able to not talk down on people who have this problem. And when you talk to someone, you're always gonna say, "What else can I? What else can I do to help? Tell me something I can do." Because sometimes, don't be you be surprised. The person can say, "Okay, can I call you tomorrow?" That's all. So they want someone to talk to sometimes. Because I can give you one example before we finish. Like at Fairview, some of the patients we have, when they come in, all they need, when they get better, all they need someone to talk about something. And when you hear people saying they don't have anybody they can talk to, that doesn't mean they don't have nobody. They have people, but they cannot. There's no relationship where they can actually be able to talk. There's no there's support, supporting system. You gotta have that. Like I said earlier, you have to say, "I'm someone who cares and wants to listen." And sometimes, you can tell the person, okay, you can. I have someone in my church. They have, something happened to them, almost the same thing, based on what you're saying. You can talk to that person because sometimes people have the same problem. Not the same, kind of close, same kind of problem. They can talk to them, to each other because they all feel comfortable to each other. And then sometimes you may see someone, you can say, okay, it seems like you're going through some, difficult time. Can I do anything? I mean, talk to, comfortable. Don't be, if they say no, don't push it. It is okay because sometimes it takes time for them to trust someone else because they may have problem with the previous person and everything. It takes time. And it is a serious situation. You have to be able to help people because talking with people give them hope. Like I talked earlier, there's two different types: suicide, passive and active. Some people, when they have, they want to take their own life, they have no hope. This is why people say, you know what? Why life has no meaning, and they have no hope. And do not think so. Okay, oh, you don't believe in God. Why you don't have hope? No, some people they're going through some stuff. They have no hope. So it is God put us here for a reason. We can talk. Sometimes talk with someone, give them reason. Oh, your life means something. By talking to a person, you the message you give him, your life means something. Look at, I'm talking to you because talking means sometimes you that shows you care about that person. Oh, someone cares about me, and all they need one person. Okay, they don't need more than, or they need at least one person to show them their care, and they're gonna stop. Because when someone, like when you hear the news, people take their own life. They they have, let's just say they had no hope of surviving because there's no meaning. Life has no meaning for them. So therefore, why living? And you may say, okay, but that person has a lot of money. They can have people to talk to. No, not it's not the case because you got to have that person who wants to listen to you. Yeah. Okay, when talking about mental psychiatric problems, there's one thing you to learn. One thing you have to know how to connect with people so you can help out. And then when you're talking to people, just tell them exactly what you're taking. I mean, don't try to say, okay, I understand what you're going. I think I understand. I want to understand what you're going through. Can you tell me? So you're direct, okay? Do not try to say, oh, you feel uncomfortable say something. If you are, do not say anything. Say, oh, can I have someone to talk to you? Bring someone else who can actually talk to that person. And this is what I said earlier. If you're talking with somebody or person, do not talk like they're five or they're like three. Okay? That's disrespectful. And then always stay on topic. If they talk about something, do not try to change the subject. You know, that means if you change the subject, you want to talk about yourself. Okay, if they have a problem about something, about their situation, you have to listen because so they can feel safe. Because when they talk to you, they feel comfortable, they feel safe. And always watch the reaction doing this. When you talk with people, watch the body language. If they feel uncomfortable, cut. Just okay, stop. Don't keep going because you see they feel uncomfortable. You keep talking. I mean, read the body language because that's very important. And then if you're talking with somebody, you say a lot of things, and they look kind of confused. Stop. Don't keep talking because don't just say, I want to finish my, what I have to say. I need to finish. No, if you person look confused, look upset, just stop. Even if you don't finish what you need to say, that's fine. You don't have to finish everything. So always watch the body language. That can be very, very helpful because we do the same thing at the unit. Like when we talk to like myself, when I do counseling, like groups, some people they have they may have a hard time. Some topic you start talking about everything. You can say, oh Jimmy, oh Steve, oh Steven, you want to leave? You can leave if you want. Sometimes if you feel uncomfortable, just help the person make that decision. You can go. You don't have to stay. Or if you don't like what we're talking about, you don't have to say anything. So always watch people reactions. Next. And then like okay, if you see they're sad, there's so many things you're gonna be able to see. People are sad. When people are sadness, you can actually see that their reactions. Same thing when we talk about trauma, you be able to see people reaction to to some stuff, everything. You need to stop. Try to this is what I was talking about earlier. Try to understand the body language. understand the situation so you can actually help people. And if you cannot help out, if you cannot help, just go find someone else who can. And it is okay. Do not feel embarrassed because you cannot help that person. No. Because all we need, the idea is to help the person so they can be safe and they can find something they can be get help to be safe for a long time. Next one. And then we're not gonna talk about the we're not gonna watch that video because we're almost finished. So another thing we keep in mind, depression. There's severe depression. People suffer years for many years sometimes. And we need to understand when people have this, living with this situation. Keep in mind, people live with psychiatric conditions. They're not that they cannot be identified just you're this. No, they live with that conditions. So when they live with that condition, we have to understand it is serious, very very serious stuff. We have to be able to help people like that. How do we have? Well, like I said earlier, listen. All we need to do first, listen. Be able to listen to create an environment where they trust you. They can come and express, how they, what they're feeling, and that can be helpful. When that happens, you can actually say, okay, this is what we can do. I can call someone, and then you can lead them to take some medications before anything happens, because you don't want the person to actually reach to a level where everything's messed up in their life. They cannot go because there's a point you go beyond. It's hard to go back. And as a Christians, like I said earlier, we have to keep in mind, create an environment where people feel comfortable. They can come and talk to us, ask questions, and feel comfortable where they know they're going through some stuff. They can come and okay, you know, then no one's gonna add anything to my situation. And that's something we have to keep in mind. Keep in mind, emotional pain and physical pain, the effect is the same thing. The chemical your brain produces is the same thing. When you have emotional pain, it doesn't say, "Oh, I have a physical pain." It's two different things. No, your brain, your body actually react the same way. So do not make this big distinction. Say if someone is, physical, maybe no, physical deficiency or in mental, deficiencies, there are two serious problems. Not one is less serious than the other one. No, E- even though so we have to keep in mind. In today's society, we have knowledge today. Mental deficiency, psychiatric deficiency, same thing. It is a serious situation. We have to understand. We have to spend time to understand it, so we can be able to help other people. People in our church, like I said earlier, we have to help ourselves first. Then we can help someone else. And this is where I'm gonna leave you guys. And next time I will do a better job so I will know exactly what topics, one simple topic so you guys can actually understand a lot better. Because keep in mind, psychology is fast, huge thing. There's so many things you can talk about everything. You can't just talk in 2 hours and then finish everything. No. And there's a reason why people actually take the classes. Sometimes you study for 4 years, sometimes more than 4 years. It depends if you go to grad school, things like that. So, any questions before we finish? Comment? Yes. Which? Say it again. Uh, there's a way people try to express, try to express that this way, but it's not because stress, depression, is not something that happened overnight. It is something like it starts with this, stress, simple stuff. Oh, this is nothing, and then with times, it goes beyond where you cannot even function because I have a patient who actually she suffered severe depression, and she's in one to one because they cannot leave her by herself because she she's so depressed. She's beyond because she doesn't see life has any meaning to that, and you may ask yourself, wow. And then when you looked at a young lady, you don't see anything. I mean, physically, you don't see anything. Physically, I can tell you there's nothing you see, but mentally, she's going through some hard stuff. And then she's been with us for a week now. And when sometimes you try to define depression, like you try to minimize what depression really is, like that is the definitions, is a way to express, what depression really is in simplest format, But the reality is depression is something really serious, and that's something we should really, really think about. If someone has any kind of depression, you should always, wow, try to do anything you can, information, listen, anything you can actually do to help that person. If that person allow you to do so. Questions? Yes. Hmm. Anger is just like an expression. It's the symptom. Yeah. It's not a disease. Yeah. Mhm. Correct. See, even though anger, there's something with the self. You have to self regulate yourself. Even if you're angry, there's a limit you don't go. See, if you go beyond, we talk about it. We have, I think, the last quarter we talked about, in Sabbath school. Anger is not the problem. It depends when you go beyond. When you go beyond, that's when it becomes a big, serious problem. Uh, the express. Mm-hmm. Correct. That's correct. Anger is a good thing. Oh, okay. The anger you're talking about now is when someone cannot, like, they have a, anger issue that they can't, they can't control themselves. If they're angry, they go beyond. Because I do have a student in my school, and he has a situation like that. But in in the simplest form, we say anger, but he has a psychiatric problem also because he has the anger issue where you cannot control yourself. Where when you're angry, you you're unable to see anything. When, that case when he is angry, he start destroy. I mean, he can destroy the entire the entire place in here. No. Uh-huh. Uh-huh. Oh, that's genetics. Yeah. See, some people. See, the thing is, if you say something is genetics, that means they have no choice. That means you have. They're just like you have it in you. It's not. It's not always not because it's two things: the environment plus genetics. You can have an anger issue. That doesn't mean you're gonna destroy anything. It's gonna be any kind of problem. No, everybody can get angry. Yes, you can. Yeah, you more learn. Yeah, because the environment and also. Uh, but keep in mind, it's also environment plus genetics. Because some people they're genetically they're more calm than someone else. But at the same time, even though you can self-regulate yourself because your brain can. The only thing you have to learn, but your situation is people. Some people do have other problems. When we describe it, we say they have an anger problem. It's not just anger. They have another. They have different name for it. See, when you say this is an anger problem, but as a psychologist, if we test that person, we find out something else that linked to that the situation they have, and that's why some people when they're angry, they cannot function. I met people that talk to me. They say because they're so angry, someone says something to them in college, they just leave. They never went back to school because you talk to me, you say something I didn't like. Why did you talk to me like that? They're unable to control their anger. See, that's what we're talking about. People, you may have problem. You have to manage situation, your situations. We all have stress. Manage, be able to manage what we have is what we can do. Some people can do it better than the other. Some people just, like myself, I do not get angry like most people. I'm more calm because people can see that. Even in my unit, some patients come to me and say, "You always calm," and I said, "Okay," because they don't see fear, anything in my eyes, everything. You can some people be able to have that, but at the same time, you need your environment also can play a big factor in your how you behave in life. It's not just one, always genetics and environment. Any other questions? Okay. Okay, that's the end. And thank you everybody. Just keep in mind, psychiatric conditions is a serious situation in life. Keep learning about it. Be able to help friends, your loved ones, because this is something you're not gonna. It's not gonna go away. Same thing when people have different problems, everything. Learn how to deal with the problem. One thing we know at the end, when God comes, everything will be clean.
Amen. Thank you, Doctor. Dr. Stefan Pompilus. That's a lot of useful information. Thank you for that. I think what I heard something about respecting other people, no matter what, right? That's what I heard. I heard try to be like